Hello and welcome to this series of videos related to curriculum development in health profession education. My name is Mohamed Hassan Taha and I am a medical educationist with the passion to advance health profession education to improve the population health. Today's session will be about a very important topic about clinical presentation curriculum or building learning around clinical problems. Clinical presentation curriculum is part of this approach. Problem-based learning also is part of this approach, and we will discuss how these things are important with emphasis on clinical presentation curriculum. So the session will be building learning around clinical problems and presentation. So the educational rationale, traditional curricula assume knowledge precede practice. So for this reason, we will see basic knowledge and then clinical knowledge, and there is a gap between them or like artificial wall between them. Clinical problems curricula assume knowledge emerges through the engagement with practice. And clinical problems, usually we consider them as knowledge generators. And clinical problems function as enhancing cognitive process and clinical reasonings. Also, they organizing the schema for knowledge so that the learning will be clear. And they are considered as a driver for intrinsic motivations because contextualized approach and relevant to the practice. Learning is contextual, socially mediated, and purpose directed. So what are the limitations of discipline curricula or phase curricula? There is a fragmentation in the knowledge. There is a delay meaning of construction of the knowledge and reduce the transferability to clinical practice. You may see students that are good in knowledge, but they are not, is not reflected in clinical practice. So what is the clinical presentation? Clinical presentation is something similar to task-based learning, and clinical presentation curriculum introduced early in Canada in Calgary University, which is based on the problems, patient problems presented to the doctor or other healthcare professionals. And clinical presentations were defined that represent common problem in the community. The patient, the group of patient, community problem, community health problem that the physicians and healthcare professionals encounter in their practice. And the presentation here identify also has to be important, the clinical presentation, and substantive enough to cover broad content so that the learning outcomes can be met. So we need to choose specific type of cases around which we can build the curriculum. The rest of the presentation will be built on this paper describing the experience of Calgary University, Canada, about the clinical presentation curriculum. I encourage you to read this paper. Let us go back for the traditional curriculum. The traditional curricula is discipline-based. Some of them use body system or clinical problems introduced in a problem-based learning. And each one of these has its limitations. Non-fully integrated learning theory, clinical reasonings, and the community needs. For example, even with problem-based learning, some studies has criticized this approach with not having scaffold knowledge or structure knowledge. And it depends also on the facilitation skills and the quality of the case scenario. And the rationale here for the clinical presentation as introduced by University of Calgary, Canada. Human body react in infinite way, and patient presented in a predictable patterns. And this pattern defines the domain of the knowledge. So it's very important to start with the clinical problems here and then go back and study the normal or the body system and so. So what is the structure of the curriculum described in this paper? The structure around 120 clinical presentation, each assigned to faculty, and there is a terminal objective for each problem, and there is enabling objective for each problem. The terminal objective could be considered as here as EBA for each problems, and the enabling objective could be considered as enabling competencies. The curriculum is governed by the curriculum committee, so the central committee is accountable for the curriculum, and departmental ownership for the enabling objective, and the curriculum maintain the governance for the curriculum committee maintain the central oversight so that to avoid fragmentation. Now let us explore the terminal objective concept used in this curriculum. The terminal objective define what graduate must be able to do, similar to the competencies, and organize around 6 clinical activities in this part or this type of the curriculum. And there is a flexibility here, is either to be 6 or to be more, but it should not be too many terminal objective. For example, here around taking the history, perform the examination, generate differential diagnosis, oral investigation, understand national history and prognosis, provide prevention and management counseling. And this figure describes this in detail. Here you will see the six terminal objective, and here you will see, for example, this is a loss of consciousness problem. Here the general objective will be written in each one, and then here for this is the common cause that can lead to this problem, which is loss of consciousness. For example, the terminal objective, we use a loss of consciousness as example. There is this differential aortic stenosis, cardiac arrhythmia, vasodepressal syncope, orthotic syncope, cerebral causes, and carotid sinus syndrome. As you can see here, and you can see here the terminal objective, and then we should do this sort of the mapping. The major theme integrations here, and this cross-cutting in this curriculum, and this could be considered as example, and each college can decide about the major theme integration. For example, here health promotion, disease prevention, ethics, medical informatics, population health. So this could be considered as cross-cutting theme included in this part of the curriculum. And it's very important to ensure the horizontal coherence. This is example of one important approach of curriculum, clinical presentation curriculum, or learning around clinical. And the key lessons here for medical educators, we need to think about how to organize curriculum around how patient present. We need to define explicit terminal objective, link basic science to clinical reasoning, central governance but share responsibility, use technology for curriculum mapping, and continuously update the structure. Thank you so much for watching this video. The next video will be about learning in the community and discussing the trend in the curriculum design, apprenticeship models versus the trend models in medical curriculum. Thank you so much for watching this video, and looking forward to see you in the next video.